close out the presentations with John Ruffolo, who are very excited to have you here. We tried to have you on a few weeks ago on one of our weekly sessions. Didn't work out, but it's actually maybe a silver lining because now you get to be here with us tonight.
That's right.
Share your thoughts with us. So John, I will let you take it away, and I will actually let you introduce yourself because what is on LinkedIn is not 100% what you're doing right now.
Well, thank you very much, Maggie, and thanks for all the previous speakers. I will try to keep it short as we will go into group sessions very, very shortly. As you've heard from this impressive group of speakers, there was one thread that knitted everyone together, and that's innovation in the health tech sector. And while this is a very trying time for many people, particularly from a healthcare perspective, it's also an exciting one. And it may not be exciting just yet, but hopefully soon and around the corner. And listening to the presentations, I'd like to draw a couple of conclusions. Number one, and might be a bit of a controversial conclusion, is that I would suggest, and it's been suggested with some of the panelists, COVID really hasn't changed anything per se. What it has done is amplified or accelerated underlying secular trends that should have been there for many, many years. A lot of what we heard about digital healthcare has been an opportunity that we've been discussing for many, many years. But for some reason, and really mostly inertia, particularly in Canada, that product market fit didn't just seem to be there. But what COVID has done is given an immediate shot of adrenaline and has accelerated probably what would have already happened, but it would have taken us years. On the opposite side, or in addition to this, COVID has also exposed vulnerabilities, and we've seen the vulnerabilities on some of the critical supply chain in the healthcare sector. The fact that we couldn't even produce our own PPE, is somewhat shameful for this country. So now that we know where the exposures are, there is an opportunity to address them. And so, as we get through this second phase of getting back to work, the phase following that, I like to call it the recovery and reimagine phase. And I think that what we've heard today is digital healthcare will be one of the preeminent opportunities. So what do we do as an ecosystem? What do we do from a public policy perspective to really drive the opportunities around digital healthcare in particular, or really not even digital per se, but rather the new way of doing healthcare in a cheaper, better, more efficient fashion? And as part of the Council of Canadian Innovators, where we spend a lot of time on the healthcare area, there's three specific areas that I think that we as an ecosystem need to address, and together from a public-private perspective. The first thing is the access to capital. A number of these companies are starting to scale, and we're starting to see now market adoption happen absolutely rapidly. So a number of these folks are going to need capital. And when I say capital, we're talking right through the full chain, from early stage seed and pre-seed capital right to the late stage, and bringing these companies right into a public vehicle. And the challenge with COVID right now is a lot of the funding opportunities or the funding sources have had a hiccup. And what we might have to do, and we did this really back in 2009, is we might have to temporarily seek some help from the public sector to, again, give the capital sources a shot of adrenaline, so that we don't lose all the great capital sources that have been produced over the last 10 years. The second area is the access to talent. Nobody is going to be able to build a business without this talent. The great thing on the talent in the healthcare sector, this is an area of tremendous advantage for Canada. I would put up our healthcare folks up against anyone in the world. We've heard from so many talented people already. That is not our issue. Our issue is one of having the scaling up talent to build bigger and sustainable companies for this country. And a couple of the areas from a public policy perspective is, thank God for Trump to the Canadian sector with the bumbling move of the visas being cut off in the United States might be a unique one shot of adrenaline for the Canadian system, where we have a number of tech savvy folks from around the world. If they want to come to North America, come to Canada. And there's a really unique opportunity for this. And other things like incentives, one of the challenges is going to be is that we have spent a lot of money from a governmental perspective, and at some point it needs to be paid back. And that might put a lot of pressure on our taxation systems, which will have an impact on our access to talent. So there's a lot of things that we need to do and think about. And we talked also a lot about from a diversity perspective and ensuring that we have people from all sources of society that are involved in the digital health arena. And the last thing, and is probably the biggest issue that's very acute to this sector, and it's really the access to customers and markets. The delivery of healthcare is generally a very localized delivery mechanism. And so we have to look for opportunities, particularly in single payer systems, to help a lot of the companies here by procuring the services in their own backyard, and helping our various governments here understand that in our own backyard, we have some outstanding companies, and we don't need to be sourcing around the world for companies that we already have here. And so this will be another great area of opportunity.